Hello, and welcome to my podcast, Ready for Robotic Knee Replacement, with your hostess, Tiffany Schmitz. Today, I'll be discussing the robotic knee replacement surgery itself, as well as what to expect from early talks about knee replacement to preparation for surgery, as well as aftercare. A knee replacement is a procedure performed to fix the damaged parts of a knee with different types of implants. Advanced technology like robotic assisted devices can help your surgeon perform a precise knee replacement surgery personalized for your specific anatomy. So, what are the benefits of using robotic assisted technology? There are many potential benefits in using this technology for your knee replacement. Robotic assisted technology may allow your surgeon to perform a knee replacement tailored to you, as mentioned before, providing both the precision and accuracy during the procedure. The technology gathers details and data on your knee that helps your surgeon select the right implant fit for your anatomy. So, in addition, the robot assisted technology may deliver a greater range of motion. This is how well you can bend and flex your knee after surgery. There's less pain compared to traditional knee replacements. There's faster recovery times, including reduced length of hospital stay, hospital readmissions, and health visits. So, how does the robotic assisted replacement compare to traditional? The goals of robotic assisted knee replacement and traditional or manual replacement are exactly the same. The takeaway is to restore the knee joint by removing the damaged bone and cartilage and to replace the damaged surfaces with a knee implant. So, how does the robotic assisted solution work? One of the ways, other than mentioned before, is it works interoperatively without the need for CT scans, which saves patients time and money. The use of infrared cameras and optical trackers to help your surgeon gather the necessary data about your knee's anatomy. And it works exclusively with the specific knee system, which have provided over 1.5 million patients worldwide already. So, when contemplating knee replacement surgery, you'll want to obtain detailed information from your surgeon. Some topics and questions to consider when preparing would be to talk about your medical history. Make a list of all the medications that you're taking. Tell your surgeon about your lifestyle. Examples like your activity level, if there's sports that you like to do or hobbies, etc. These are all good things for your surgeon to know in taking into consideration what your goals are going to be post-surgically. And don't be afraid to ask questions and ask for clarification. Some questions to ask? What type of knee replacement do you think is appropriate for my situation? As there are different types, your surgeon would be the best person to tell you which would be the most beneficial for you. Another question is, what are the knee replacement techniques and technologies available? Again, going back to that, would you be a better candidate for open versus laparoscopic or robotic? Can knee replacement surgery help relieve my pain and stiffness? Those are excellent questions because we want to know, is it going to help if we're going through a surgery? What are the benefits and risks of knee replacement surgery is a good question. How long it would take to recover and rehab from your knee replacement with the robotic assisted solution versus, say, having it done open. And what is my role as a patient in recovery and rehab? Like, what are the expectations of yourself or myself as a patient? Those are good questions to ask. If I undergo technology assisted knee replacement surgery, will I be able to resume daily activities? The goal is yes. So, in planning for knee replacement, it can be overwhelming, but being prepared can help your recovery process go much smoother. There's a few things that you can do to help get prepared. There are a lot of things to plan for. but being prepared will make you feel better about it and help you get back to the moments that matter. So make caregiver arrangements. That's a big one. For the first few weeks after surgery, you're going to need someone with you for most of the day to help with everything from preparing meals to getting in and out of the bath. You should learn as much as you can about knee replacement surgery. So get educated about the surgery with your doctor or a community health education class. You should schedule any dental work to do before surgery. Um, Even just a cleaning, have it done before your surgery to reduce the risk of infection getting into your joint. Once infection gets into a joint, it's really hard to eradicate it. It could set a patient up to need to have a revision. So schedule those ahead of time. You should get medical clearance. So your surgeon will likely ask you to get medical clearance. You should get this with your primary care physician for pre-op history and physical. Reduce risk factors. Quitting smoking if you smoke. Drinking caffeinated beverages, taking herbal remedies and other things that your surgeon recommends. Cutting back on and or quitting. Donating blood. Talk with your surgeon about whether or not you should donate blood prior to your surgery for possible use in blood transfusion. You're going to need some time off. So if you're employed, take time off for your surgery and recovery. You could find out if you qualify for disability insurance through your employer or through the state. You should plan on getting a temporary disabled parking pass. Ask your surgeon how to apply for one. Those will help tremendously in the weeks and months after till you get back to your regular stepping. It'll provide you with a closer spot to park when you go to the stores. So how should I get medically ready for surgery? The hope with knee replacement surgery is that you can get back to doing what you love before you were interrupted by knee pain. To get the best possible outcome, less pain and less swelling, increased range of motion, and improved strength. You may need to adjust certain lifestyle habits in the weeks leading up to your operation. So that would include nutrition. Prior to surgery, you should pay close attention to your nutrition. Protein, calcium, and vitamin D all help in bone healing process, and your surgeon will let you know if you should be taking any supplements beyond what you're eating. Also, it's important to stop taking any herbal medications 2 to 3 weeks before surgery, as they may interact with anesthesia, along with abstaining from alcohol and caffeine at least 1 week before your surgery, as they may cause bleeding problems during and after surgery. We definitely don't want that. Weight loss is a big thing. So since your knees bear most of your body's weight, heavier patients present more complications during and after surgery. So talk to your doctor about your recovery, and physical therapy would benefit lowering your body weight and what right program might be for you. Stopping smoking. That's on here again. So studies show that patients who smoke experience almost 50% more surgical site infections and pulmonary complications such as pneumonia as patients who don't smoke. So it may be a good time to choose to quit in the weeks leading up to your knee replacement. But if you don't or aren't, if you're not able to talk to your doctor, they'll most likely ask you not to smoke at least 24 hours before your surgery. Other medical conditions. In the weeks leading up to your surgery, let your doctor know if you become ill or experience any other medical condition, including everything from the cold or flu to a sprain, an allergic reaction, or an open wound. These are all things that could affect your surgery scheduling. So let your surgeon know and they'll determine if you need to reschedule the procedure. What are some preoperative exercises? Exercising daily can help you prepare your body for knee replacement surgery. As the stronger your thigh and leg muscles are, the more stable your knee joint is. Don't start anything brand new right before surgery, though. These are things to do in the weeks leading up to surgery, maybe some things that you already do and that your body's familiar with, or just graduate into a safe exercise program that's advisable by your surgeon or physical therapist. Don't want you to start, training for a marathon type activities and injure yourself, and then you can't go into surgery, knee replacement surgery, if you've pulled your groin muscle or strained your calf or ankle or something. So be careful with those. So let's talk about after surgery. So you've done all the prep work, you got the surgery done, recovery and rehab. So now that the surgery's over, it's time to focus on your recovery and rehab and getting back to enjoying your days with family and friends with relief from your knee pain. So here's some things to know about post-op care. The goal of rehabilitation therapy is to improve your muscle strength, increase the movement in your knee joint, and protect your new knee joint, return to the activities you did before surgery. The frequency and duration of therapy may vary based on your needs. So during your first week post-op, you may experience some pain along with discomfort while exercising, but you should see noticeable improvements each and every day. After 2 to 4 weeks, you'll start to feel like you're getting back to normal. But since everyone recovers differently, it's best to listen to your body and to keep in close touch with your doctor along the way. Before your surgery, you and your doctor will have decided where the best place for you to continue your recovery is, which could be at a rehab center or at home. And like any operation, there's a risk for complications such as infection and DVT, deep venous thrombosis, which is when the blood in large veins in the leg form clots. So it's important to learn about what happens when you leave the hospital so you can do all that you can to make recovery as safe and as speedy as possible. Talking about home, what arrangements for home should I make? Have a close friend or family member by your side to assist you through your recovery can make a huge difference in preventing a range of potential complications from wound care to falls. Your other option, if it's covered by your health insurance, would be to arrange for home health care services. What's covered and the duration will depend on your health insurance plan. So please check with your health insurance provider prior to making any arrangements. There's things that you can do to help with your healing. It's normal to have temporary swelling, pressure, and or bruising your ankles and feet, and these may last for a few months. However, always discuss symptoms with your doctor to make sure nothing disrupts your recovery. A couple of things you could do is to ice your knee. Always cover ice packs in a towel to avoid frostbite. Yes, that is a thing. You can wear compression stockings, elevate your leg with a pillow, do ankle exercises, and your pain will be managed with medication for optimal results and comfort. The first 24 to 48 hours after surgery, you'll likely experience substantial discomfort, varying from mild pain and pressure to significant pain, which will be managed by your doctor with medications, so like NSAIDs or non-steroidals. Opioids, you'll probably be given something to help with constipation since you're going to be on pain medications. A lot of times that tends to constipate people. After 10 to 14 days, you'll usually be able to stop taking strong pain medications as you're getting back to normal. You may be keeping your legs elevated a few times a day for the first few weeks, and elevating your legs 6 inches above your heart will be helpful. You'll need to change your position often. Avoid standing or sitting for more than an hour at a time. You're going to reduce the amount of salt in your diet as it causes fluid retention. Avoid crossing your legs when sitting. And there are some do's and don'ts for surgery. I'll keep these short and sweet because we're about out of time. So do keep up with your exercises. Engage in low stress activities like golfing, hiking, walking, biking, and swimming when these are safe to do. Manage your pain. Be sure to take your medications as prescribed by your doctor, because if you're in pain, you're not going to want to exercise and move around. So we got to keep your pain controlled. Some don't. Avoid activities such as competitive sports like racquetball, high impact aerobics, high impact jogging, running, rough contact sports. I feel like these go without saying, but for those who need to know, those are don'ts. Don't twist your knee. You'll want to avoid any jarring forces on your knee. So instead, you would turn your entire body to avoid stress on your knee. Don't schedule dental work or surgical procedures on your bladder or colon right after surgery or in the immediate weeks after surgery. You would need to get clearance from your surgeon before doing that because of the risk of infection. Don't lift heavy objects. Don't push yourself too hard. While you want to get back to your life, it's important to give your body time to recover. There'll be some lifestyle changes now with your new knee joint. You'll just need to make smart, healthy choices to help keep your new knee in good shape. Managing your weight is going to be an important part of that. Wearing the right footwear, exercise, being careful on stairs, nutritional supplements. And as with any medical treatment, individual results may vary. The performance of knee replacements depends on age, weight, activity level, and other factors. There are potential risk, and recovery takes time. So people with conditions limiting rehabilitation should not undergo surgery. Only an orthopedic surgeon can determine if knee replacement surgery is an option for you. That's about all I have for you. I hope you enjoyed my podcast and can take away some important and helpful info. Thank you and have a great night.